All right, y'all, it is time for your health check. You know, every day seems to bring more and more questions about COVID-19. And to help keep you and your family safe during this pandemic, I've got Dr. John Carlo joining me now. He is CEO of Prism Health, also a member of the Texas Medical Association Task Force. Good morning, Dr. Carlo.
Good morning.
So from a Daybreak viewer, saliva tests are said to be less sensitive. We talked about this a little bit yesterday morning, and that could lead to false negatives. But we're hearing more about them because they're more comfortable than those nasopharyngeal tests. Do you recommend the swabs over the saliva tests?
Well, keep in mind that there's the type of test and then there's the way the test is collected. So, you know, the best test right now is still what's called the PCR test. And the best way to collect that test is through the back of the nose, the NP swab, as we call it. There are some studies that show that the PCR test can be done with a throat swab or even saliva, but this is still very, very early. And I would actually not recommend at this point going with that test, even though it's more uncomfortable to use the NP swab. It's just simply better. I want the most accurate test that's available, so I would go with that.
Okay, that's good to know. Thank you. Now, this is from Lindsay. She says, as a dyslexia teacher, it's important for our students to see the shape of our mouth as we talk. So has any research been done on those clear masks to see how effective they are compared to cloth masks? And this is what we're talking about. People can see this on their screens right now.
Well, this is something certainly we have been thinking about. There are many situations that, the face mask may not offer, it may not be possible, especially in education settings. This is something that we've been thinking about. The question is whether a face shield, which would be a clear plastic, almost like guard that would cover your entire face, eyes, nose, and mouth, is that as good as the face mask, or is that a good replacement for the face mask? And, at this point, I would say that the face mask is still much, much better. In those situations where you can't use it, would the face shield be a good replacement? It's probably not as good, but if you were going to choose between a face shield and nothing, I think the face shield would offer some protection. But again, I think the face mask is going to really be the best solution in order to prevent those respiratory droplets from spreading larger distances.
And our last question is from Bill this morning. Are there any stats about the people who have died from this virus in terms of what percentage of those people were wearing masks, habitually? Is this a question they're even asked by doctors or at hospitals? Now, I imagine, and what I responded to Bill is, I'll ask Dr. Carlo for you, but, if you are being hospitalized or admitted into a hospital, a doctor's not going to want to shame you, just going to want to save your life.
Well, yeah, it is a good question. I think we won't know the answers to this one. I do think that, just like you said, when somebody is critically ill, the main thing that we need to do is try to save that person's life. So we generally won't have that question or that information. It's just simply something we're not going to collect. We do collect quite a bit of information on our cases, and there will be a pretty good amount of delay in getting more detailed information around deaths. But it's something we certainly are collecting in terms of just basic demographic information, but also health history and things like that. But mask use is probably not going to be something we'll have in that information.
Okay, Dr. Carlo, thank you as always. We'll talk to you again in about an hour.